please could you tell us a little more about what NHS England was hoping to achieve when it commissioned OBE?
Really good question. I mean, NHS England have been in place since the Health and Social Care Act of 2012-13, and I had the pleasure of taking on the responsibility of both the Director of Health and Justice, which is services in prisons, in police custody, in courts, and also the armed forces community. And I think what I found and my teams found, but most importantly from lived experience men and women that were in the armed forces community or in the criminal justice system, is there was a gap. And there was a gap where you were doing the referrals and the support of people in the criminal justice system who had also been in the armed forces community or were currently in the armed forces community. So I think what OBE was in the very early stages was the coming together of some really good ideas and really sitting down with lived experience, with clinicians, charities, saying how can we get that pathway right for men and women who are and have been in the armed forces community but now in the criminal justice system. We know statistically that on the whole there are very few people who are veterans or their families that commit criminal offences. Let's be really clear about that. But the small percentage that do, they're quite often quite serious offences, and they're also quite often late in being discovered or discussed as part of an armed forces or combat related background. So the background very much was getting some pathfinder services in relationships and understanding with police custody suites, with courts, with the veterans community, and seeing whether this gap was a big one and whether that was something we could do at scale.
Okay, and that piece about the veterans not identifying and it's not been identified before, what do you think it is that is stopping veterans from saying that they'd served?
I think it was, and I think it still is. I think that's why OBE is absolutely needed, is that for most people in the criminal justice system, you know, it's quite a difficult thing to talk to your mum, to your police officer, your social worker, your health worker about the fact that you have an offence. And it could be shoplifting, it could be drug related, it could be violence, you know, all extremes, and also sex offenders. And so when you have a history and you have, if you like, I guess really, you know, the kind of the outward stuff around the armed forces community and the moral high ground and obligations that you are because you've served, to then say, well, I have served, but I've also committed offence, and I'm also not quite sure what that has done for me, but done for my family, you get a shutdown. I mean, I've been in a meeting this morning with my amazing OBE colleagues, talking about and working with lived experience who say absolutely that is the hardest thing, is to say that I've served when you've got a criminal justice history or when you're currently sitting in a police custody suite.
Thank you. And how do you think that the rollout of this important service has gone so far?
Look, I mean, I think it's fair to say that it's taken quite a few years to get to this point. We're now sitting in 2025, and I talked about the Health and Social Care Act in 2012, and there are a number of really important junctures on that way, sitting down with the Ministry of Defence, sitting down with the Ministry of Justice, sitting down with the Health Service, and saying everybody thinks everyone else is taking responsibility for this group of patients. I use the word patients appropriately. In the armed forces community, and I think when we work with, you know, Care After Combat, with NOVA, we've got Courage coming on board as the mental health service, with the liaison and diversion services that are commissioned in the police custody suites from the NHS, then I think that was a time around sort of 2014-15 that the most important thing to do was to get a model that we could put a function around that the NHS could then commission formally. There was much too much that's been done with grant aid money. There's great work going on, but it was year on year. We needed to make that stronger. And so I think what we've achieved is bringing all of those good ideas together and then now having a national service which is commissioned to support both police custody and courts, early interventions, community-based sentences, but now also the pathway in our adult prisons, of which there are many.
And so from this point, where do you see it going in the future as part of the NHS Armed Forces Healthcare Suite?
I think the most important thing, I can talk as a director in the NHS, but the most important thing is what people say that have received the service. They said, look, you know, that has helped me with a recent suicide attempt, that's helped me when I've been disconnected from my family, that's certainly helped me when I'm sitting in a police custody suite and not knowing who to talk to, when a police officer or a worker from up over or someone comes on and says, have you served? Then all of a sudden that has a very positive, you know, kind of dominoes effect of looking at that package of care, of support, of reduction of offending behaviour, but also what that means as a knock-on for families and the broader community. So where we go is we absolutely need to look at all of our police forces, all of our custody suites, all of our courts, look at the work that's happening in the services that we're developing in prisons and make quite sure that we can get this consistently and also learn from lessons from lived experience when we might be going up one way and we need to stop and start again because it was much more effective if you've got, you know, peer support in that package or you've got support that also includes families. So I'm really proud to say that NHS England now commission the national contracts for this service, and to maintain that, to learn from it and to grow is absolutely the right thing going forward.
That's brilliant. And finally, we're really coming together with Up Courage and other NHS forces to say the Say You Served campaign. So we're all talking to veterans to encourage that. Is there anything that you would particularly say to a veteran that needed to say they served?
Yeah, and I think it's important that we talk about men and women. You know, the women are more likely to say, as people who have served, that they don't necessarily see or call themselves a veteran. Certainly younger men and women that have come through recent conflicts are finding it that there's quite a kind of big sort of World War I, World War II. We've just come through the amazing celebrations of the 80th year for VE. I think it is really important that when we ask people as a GP or as a police custody officer, have you served, that we know that that is as different as there are people, and to just check what that really means on an individual basis. And it could be that it's a recent event, or it could be many, many years. Someone might have served for many years, and they might only serve for a few days and a few months, but also their experiences, and their experiences around trauma, their experiences maybe around feeling isolated as a civilian, and also what that means around what they would like from what they could get next is absolutely